Welcome to our celebration event. We've made some huge improvements, and it really is an opportunity to celebrate success.
Streamlining is a programme or an initiative that is in place to help improve the experience of staff moving from one NHS trust to another. Each trust is a separate legal business entity, and when a staff member moves from one to the other, they are taken completely through the rehire process.
Streamlining is being instrumental in helping us think about how we can manage that information and transfer better.
The programme is around trying to make that smoother, faster, take out duplication, take out waste, so that the person can move around the NHS much quicker and much easier.
We're very keen to sponsor Streamlining, was to make sure that we were offering the best learning experiences.
The people are what deliver the patient care in the NHS. Is very, very important in ensuring that staff experience is as best as it can be.
The programme previously had looked at statutory and mandatory training, and as people move about the system they are asked to repeat that. What we did with Streamlining in the North West 3 years ago was really looked at what else we could look to apply those principles to.
So within Streamlining there are key core deliverable areas, and those are recruitment and resourcing, which is around having factual references that are based on fact and not opinion or subjectivity.
At our trust we centralised the writing of references, so that frees up our managers' time and our clinicians' time to ensure that they can focus on patient care, and those references will be completed factually on behalf of the organisation.
The other key area that we looked at was values-based recruitment, with a particular focus on the actual interview stage of the recruitment process.
They're around training and aligning all our training to the core skills framework, so that all the refresher periods are aligned and all the competencies flow through from one organisation to the next and nothing is repeated.
And we've got that pretty much embedded right across the North West, whereby your training records are sent with you when you move from one trust to another.
The North West so far during the lifetime of the programme has loaded 300,000 competencies into ESR.
In addition to that, we've been looking at occupational health, and that's making sure that we share information on IMS and VACs promptly and quickly as part of the recruitment process, so that we don't have to redo blood tests to test on immunity, and people can start as soon as possible.
We're now starting to see those move about the system appropriately and safely.
And then finally, policy work to make sure that our policies are aligned as much as they can be, and that we can move staff effectively, because notice periods, contract terms, conditions and things are all aligned, and therefore it's easier to move staff across organisational boundaries.
We broke the programme down into Cheshire and Mersey, Greater Manchester and Cumbria and Lancashire. In Greater Manchester they looked at other types of training, so as well as the statutory and mandatory training, they've looked at dementia training.
We worked with the dementia subject matter experts from each organisation, looked at what training was out there and found that there was a real inconsistency. This has subsequently led to us developing an outline of a programme that we'd like to see, which is now going into implementation and will be rolled out across Greater Manchester over the next few months.
In Cheshire and Mersey they looked at a range of things, including for example the honorary contract. So there is an honorary contract in place which allows people from one trust to work temporarily in another.
A process that's often can be quite lengthy and unnecessary delays, if you like, because of misunderstandings between trusts of who does what work and what's within that contract. And so we've developed one standardised honorary contract for the patch, so there's no surprises, but also a supporting document that it makes it very clear about whether it's the host trust or the substantively employing trust and who does what at what stage of issuing the contract.
In Cumbria and Lancashire they had very varied and wide variety of things that they looked at, everything from establishment control to a careers and engagement service, and that's the beauty of Streamlining really.
And I was very pleased today to see that overall the region's achieved £2.7 million of savings financially.
That's not a cost to take out of somewhere, that's an efficiency, that's from time, that means people being able to do work rather than sat in an induction.
We've got happier staff that are being released to the wards and clinical areas quicker.
And we've had a tweet and we have a staff success story. Just check my mandatory training. It's already been transferred from the old trust to the new trust without me having to do anything. I'm actually amazed.
I came into the project thinking that this project was all about streamlining transactional services, which it is, but actually one of the biggest things that have come out of this project for me And what I take away from that is the networks and the sharing and the relationships.
It's really helpful to now have a number of people who work in the same role as I do that I can call upon at any time, whether by phone or email, and ask them for help or ask if they're willing to share procedures.
What it's done is generate real enthusiasm for streamlining. What started off as a difficult process initially, that enthusiasm has built over the 3 years of the programme, and there is that real appetite, if you like, to continue that good work. So we hope to do that, and we're talking today about how we can continue that and make sure that momentum happens.
While we're celebrating the end of the programme, this is only the beginning, and I'm looking forward to working with you all as we drive forward those efficiencies, drive forward that production.
We also hope to inspire other areas that haven't started their streamlining journey yet to be able to look at what we've done and how we've done it.
Streamlining is a philosophy. We should always take any and every opportunity to challenge what we do, to see how we can do it better, to see how we can do it in a more collaborative and productive way. And so if that's the philosophy continues, then that will be fantastic.